Now, MPs, a committee, have been warning about a growing crisis in emergency care. A&E departments in England are said to be stretched because of rising demand, as we were telling you a little bit earlier. Well, Julia Manning is the chief executive of 2020 Health, which is an independent think tank. She joins us from central London. Good to talk to you, Julia. First of all, I think we all know this. You agree with this analysis?
Well, yes, this has been a subject of a lot of discussion over the past few months, and this report has come out ahead of the government's own review, which is due this autumn, where they're looking at how to deal with the perceived crisis in A&E.
What is going on? I mean, there's no one. It's a complex number of causes, isn't it?
Yes, there are lots of issues, and I think one of the things that the Health Select Committee report highlights, which is really important, is that a lot of the data conflicts. So they are calling for much better data collection so they can have a better understanding. Those who are commissioning and managing services can have a better understanding of what is going on the ground. But some of the stats that are in there that aren't contested, I think, are really startling. And the one that really shouted out to me was the fact that 43% of people attending A&E are aged 29 and under. And I can't but help think that's a huge rise in young people going to A&E.
Yeah, it's interesting. I mean, what would you put that down to? Is it, rather more footloose kind of constituency who don't register with GPs and just regard it more or less as a walk-in centre?
Absolutely, and I think the proliferation of walk-in centres, urgent care centres, have actually encouraged people not to go to their GP, but go to the local A&E department where they know they're going to be seen probably within 4 hours, although that's one of the issues that the report is highlighting, that that is less likely now. But we're still seeing over 90% of patients seen within 4 hours. But too many people are going to A&E instead of going to their local GP. GPs can do an awful lot to encourage patients to come and see them as a first port of call, and we should be holding GPs accountable. And we should also be looking at the patients attending A&E and whether that's appropriate as well, and talking to them. And one of the things that the report doesn't talk about is the fact that we already know that 30% of people going to A&E on the average day are there because of alcohol, and at the weekend it's up to 70%. And what this report doesn't do is look at sort of the upstream causes, and that is one of the significant causes that the government has to address.
Yeah, it's very interesting that, because you're joining up so many areas of policy, and that's just not about necessarily directly about the NHS itself. I just want to return to a point you made there. It's very interesting, actually. You're talking about, and the MP's talking about it, the collection of data. Now, of course, to do that, you need the dreaded term bureaucrats. They seem to be, the word bureaucrats in NHS, everyone says, well, get rid of them, we need more clinical staff. Well, let's hear it for the bureaucrats. You do need people there to measure things and to work out where you need to deploy your resources.
Well, even more importantly than that, we need good IT systems, and IT varies hugely across the NHS. And the fact that we still don't have electronic patient records is a real hindrance to actually collecting good data. And even when we do have good electronic records, often they're not shared between hospitals and GPs and social services. So that has to be, and it already is, a priority for government, but they really need to ramp that up and speed that up so we've got good access to good data.
Well, I mean, you mentioned the IT system. They tried that before, didn't they? Didn't even manage it and spent about £20 billion on it.
Well, I think about £6 billion was spent, and there have been some improvements in the system, but that whole programme was not what it should have been. There's a recognition of that, but that doesn't mean you turn your back on IT. You need to look sensibly and intelligently at, OK, what do we need? What information do we need to have access to? And how can we enable organisations to implement that quickly?
So what's your best guess about the future? I mean, the MP's kind of talking about, well, we need an emergency for accident and emergency. It needs to be shored up for the coming winter, and then some of those solutions that you're talking about for the longer term.
Yes, one of the interesting stats is that there isn't a huge seasonal variation in attendance at A&E. So the predicted impact in winter isn't necessarily seen. Certainly, I would want to see immediate accountability for GP practices. There are some fantastic GPs out there who offer very rapid access to their services, but other GPs are not kept accountable, and the local A&E department will know which GPs are looking after their patients well and which patients are turning up regularly at A&E because they can't get a GP appointment.
Very interesting. Thank you very much indeed for your thoughts and bringing some rather new thinking into that debate.